morning. So I'm here to perform on auto scenarios. So I just got called in the ER, and then first thing is I always have to check the patient's chart, make sure that I obtain any important information, and then with that I always have to go to the patient, observe them, check the ID band for confirmatory purposes. But the first thing is we always have to wash our hands. So after doing those, I always have to do my pre-assessment, such as obtaining vital signs. And then once I get inside to the patient, I observe that the patient is only at room air, and then with the auto saturation at about 88 to 89%. So the doctor recommended to hook it up with nasal cannula at 5 liters. So with that, I always have to put this at 5. Make sure that the tubing is no longer kinked, and then before that we always have to fill it with our fingers if there's adequate air or flow coming out directly from the nasal prongs. Then we have to make sure that it's being loosened before putting up to the patient, and then carefully put it to the patient's nose like that. Then we always have to communicate or try to communicate if the patient's being able to cooperate with you, or if the relatives present that they should not put Vaseline because it might lead to any flammable because of the oxygen. And then after putting this to the patient, I always have to do my set of vital signs again, post-assessment. And then in a few days, in a few hours, I checked the patient, and then I knew that the patient was having a chronic lung disorder. And because the patient was being put up at 5 liters nasal cannula, all we have to do is we have to prevent the patient from having CO2 retention. And then we make sure that, because the patient also complains from any nasal dryness, and then the flow is just too high for them. So I immediately recommended in having a venturi mask for the patient, just to prevent from the patient's condition, which was having a chronic lung disorder, to be severe. So with this venturi mask, it would apply precise FiO2 regardless of the flow. So I have to set it at about 28%, and then with the flow. So we'll just have to tell to the patient or relatives present that they will experience a little bit noise, but this will help them just to prevent from their condition to be very severe. So have to loosen it, put it to the patient, then make sure that it's not obstructed, especially with this corrugated tubing, no blankets covering in this, and then the tube's not kinked. Okay. So after that, we have to obtain vital signs again to the patient, make sure that we take up any information such as their breath sounds, the sp2 level if it suddenly just try to rise a little bit. And then once outside, we always have to wash our hands first thing first, and then make sure we chart everything outside, communicate with the physician that the patient was doing well, and also to the nurse in charge.